In daily clinical practice, we often encounter patients with multiple compromised teeth, where both infection control and long-term rehabilitation need to be carefully considered. The key challenge is not only to eliminate the pathology, but also to plan a treatment that ensures predictable and stable outcomes. So today, I would like to share a clinical case that highlights the importance of accurate diagnosis and stage treatment planning in implant dentistry. A 40-year-old male patient presenting with multiple compromised teeth in both maxillary and mandibular posterior regions. The patient's chief complaint is discomfort during chewing and recurrent swelling in the lower left region. So we collect all the necessary data, including mandatory X-ray. The panoramic shows that there are residual roots in upper right 6 and lower left 4. The patient also have periodontitis lesion associated with lower left 5 and 6. So we came up with a diagnosis include hopeless residual roots in 1, 6 and 3, 4, and chronic apical periodontitis in 3, 5 and 3, 6. Based on the diagnosis, the treatment plans were eliminate the apical infection and preserve teeth 3, 5 and 3, 6 through root canal treatment, extract 1, 6 and 3, 4, and plan for implant placement in the extracted sites after appropriate healing. One key takeaway from this case is the importance of accurate diagnosis and proper stage treatment planning. This is the initial convexity, and in this slide, you can clearly see that there is very large periapical lesion around the root 1, 6. And in other words, there is no bone here. So we decided to perform 2-stage surgery for patient safety. The same condition with the root 3, 4. There is a very large periapical lesion around the root. So it is not safe to place immediate implant at this site. If we perform the immediate implant placement at this site and at the 1, 6 site, there is a higher risk for implant failure. So what we do is that initially we perform extraction and thorough debridement to facilitate healing and bone regeneration. After a 3-month healing period, the sites were re-evaluated before proceeding with implant placement. This is a silicone beam taken 3 months after the extraction. You can see that after 3 months, the bone has healed well. For posterior implants, we typically aim for a height of around 10 millimeters. In this case, we are slightly deficient. The height of the bone is 9.45 millimeters. So we plan a sinus lifting to achieve adequate implant height. For this case, a sinus lifting alone was sufficient and no additional bone grafting was required. In terms of bone width, we measure approximately 10.11 millimeters, while the ideal width is around 7 millimeters. So there are enough bone for implant placement. We continue to check the prosthetic space. The prosthetic space in this case is 9.54 millimeters, so which is adequate for future dental implant crown. So overall, both the bone width and the prosthetic space are sufficient for implant placement without the need for any additional preparatory procedures. So at the 3, 4 implant site, there is sufficient bone. There is no concern about the need for bone grafting. The available bone height allows for implant placement is about 10 or 12 millimeters, and we have like 7.25 millimeters here. In terms of bone width, we measure that it is approximately 7 millimeters, so it does not need for bone grafting. This is an immediate post-operative radiograph. As you can see, 2 implants are placed in the correct position, and we will continue to monitor the patient during the healing phase. So this is a classic case, highlights the importance of proper diagnosis and stage treatment planning in achieving predictable implant outcomes. Thank you for watching, and I hope you found this case helpful. If you like to see more clinical cases like this, don't forget to subscribe to our channel, Viet Intech Dental Center. Thank you.